Hello, Medicare Advantage risk adjustment operators, innovators, and learners. Welcome to another weekly learning series of the Hughes Academy Risk Adjustment Made Easy, the Medicare Advantage kind. I am your host tutor, Dr. Prince Bewa. If today is your first time joining us, we want to say welcome. Thank you for joining us today. If you have been with us in our studies, we also want to say thank you for joining us and welcome again. If you have not subscribed to the channel yet, I will encourage you to subscribe, to like, to share as we continue on our study of the CMS Supplemental Benefit Code categories that CMS shared with the Medicare Advantage organizations to submit to CMS through the benefits that the health plans offers to the Medicare Advantage beneficiaries. Last week, we started with this memo that went out in February 21, and it discussed on CMS's initiative to start collecting Medicare Advantage supplemental benefits. And we also touched on the August follow-up memo that followed up to plans to inform them that the dental benefits were ready to be submitted. Last week, we went through taking all the supplemental benefits codes that CMS published on CSSC operation website and looking deeper at them and categorizing them into different themes that are shared among them. And we use this methodology. We took all the supplemental benefits codes and we categorized the codes based on their leading numbers, and we grouped the leading numbers into different themes based on the code descriptions, and we sorted them based on the number of categories. And last week, we took the highest one and discussed the various themes that could be seen through the various code descriptions. Today, we are looking at the second highest number of supplemental benefits codes based on the leading number, which we'll be looking at today. The second leading number here is 13. And the 13 leading number has 22 different supplemental benefits codes. Through that, you can see that there are alternative and complementary care. There are over-the-counter items that you will see within these 22 categories. There are food and meals that are seen within this category as well. And there are supportive and social needs that are seen in this leading number 13 supplemental benefits codes. And there are also non-health related chronic illness benefits that are also seen in here. And finally, there are some other supplemental benefits codes that are seen within this leading number 13. Some of the specific supplemental benefits codes that you will see that are led with number 13 are acupuncture, which is 13A, over-the-counter items, which is 13B, food and produce, which is 13I1, meals, which is 13I2, social needs benefits, which is 13I6, and some of the non-primary health related benefits for the chronically ill, which ranges between 13I11 through 13I15. So looking at these categories, you can dig deeper into the supplemental benefits codes to understand areas that these categories fall. And I would really delight to see if you have looked into reclassifying the supplemental benefits codes. If you have taken upon to do that exercise, I would gladly encourage you to leave a comment there if you are doing such an exercise. I hope it was useful and helpful to you in helping you understand the various themes in the supplemental benefits categories that Medicare Advantage plans are supposed to submit data to CMS. If you have not done so already, I will encourage you to go to the website www.thehealsacademy.com/resources, and you can download some free resources from the website. And if you have not received your signature gift yet, it is From Chaos to Clarity, the Essential Medicare Advantage Risk Adjustment Data Sources Comparison Cheat Sheet, which compares the various data sources that are used for Medicare Advantage risk adjustment for you easily. And then you get the chance to also be on our email list so that you don't miss anything that we release to our audience. If this has been helpful, I will encourage you to like, to share, to subscribe. Otherwise, I will catch you the same time next week as we look at the next level of supplemental benefits categories. Thank you and bye for now.